Conjunctivitis is inflammation or infection of the mucous membrane covering the front of the eye and inside eyelid, known as the conjunctiva. Allergic, viral, and bacterial conjunctivitis are the three most common forms of conjunctivitis. There are many different causes of conjunctivitis, all varying due to the type. Viral conjunctivitis is extremely contagious and is most commonly spread through direct contact, for example from contaminated fingers, medical instruments, swimming pool water, or personal items such as mascara. Bacterial conjunctivitis has many predisposing conditions, such as abnormal tear production and disruption of the epithelial barrier. It is also caused by abnormal proliferation of the native conjunctival flora, or by coming into direct contact with contaminated fluids or fingers. Allergic conjunctivitis is due to allergic reactions. The symptoms of conjunctivitis vary depending on the type. There are two main symptoms of viral conjunctivitis, those being pharyngoconjunctival fever and epidemic keratoconjunctivitis. Pharyngoconjunctival fever is characterized by the abrupt onset of a high fever, pharyngitis, bilateral conjunctivitis, and enlarged lymph nodes. Epidemic keratoconjunctivitis is more severe, causing watery discharge, hyperemia, which is excess amounts of blood in the eye, chemosis, which is swelling of the conjunctiva, ipsilateral lymphadenopathy, which is a disease affecting the lymph nodes, blurred vision, and pain in the eyes. The symptoms of allergic conjunctivitis are the least severe, which is characterized by eye redness, swelling, itching, and in some cases, a milky pale conjunctiva. Symptoms of bacterial conjunctivitis are progressive if not treated appropriately. The initial stage, hyperacute bacterial conjunctivitis, has symptoms of severe discharge, decreased vision, eyelid swelling, and eye pain. Morning crusting and difficulty opening the eyelids are also symptoms of the initial stage. After 4 weeks, it becomes chronic bacterial conjunctivitis, which leads to an increase in pain and severity, including red eyes and increased discharge. Treatment options vary once again due to the type of conjunctivitis. With viral conjunctivitis, no treatment is required, though consulting a pharmacist for artificial tears and topical antihistamines can alleviate symptoms. Bacterial conjunctivitis needs treatment from a general practitioner, as they can prescribe antibiotic eye drops and a pharmacist for relief of symptoms. With allergic conjunctivitis, if severe, GP consultation can be required for antihistamines. Otherwise, a simple pharmacist can be consulted for symptom alleviation. Topical treatments are recommended for conjunctivitis. Topical treatments are convenient, cost-effective, and capable of alleviating symptoms associated with bacterial, viral, and allergic conjunctivitis. Therefore, topical treatments are a superior response to the treatment of all types of conjunctivitis. The health professionals suggested to help in the treatment of conjunctivitis are dependent on the type of conjunctivitis the individual has. In terms of viral conjunctivitis, there is no immediate or necessary treatment required. Therefore, a pharmacist is the only possible health professional needed, as to recommend artificial tears and topical antihistamines for alleviation of symptoms. Bacterial conjunctivitis requires a general practitioner to prescribe antibiotic eye drops as well as the assistance of a pharmacist. Allergic conjunctivitis is the least severe of the three, though can be inconvenient. Therefore, both a GP and a pharmacist may be useful in terms of providing symptom alleviation. If treatment is occurring in a person's home, ensure hands are regularly washed and all items that come into contact with the eye directly or eye fluids are to be sterilized regularly.